In this video, I'm going to talk about muscles of the trunk, in particular the back extensors and then the muscles of the abdominal wall. So the largest group of back extensors is the erector spinae. It's a superficial group of back extensors. It's actually made up of 3 different muscles and then further divided into 3 other muscles, so a total of 9. So you have the spinalis group, which has a capitis, a cervicus, and a thoracis. You have a longissimus group that has a capitis, a cervicus, and a thoracis. And then you have the iliocostis group that has a cervicus, a thoracis, and a lumborum. So the spinalis group generally lines up right over the spinous processes. The longissimus group generally lines up right over the transverse processes. And then the iliocostis group, think cost means rib, generally lines up along the ribs. Okay. And then the names for the subgroups are named for their insertion spot. So if it has a capitis in the name, it's going to attach somewhere on the head because that's where you wear your cap. If it's got a cervicus in the name, it's going to insert somewhere on the cervical spine. If it has a thoracis in the name, it's going to insert somewhere in the thoracic spine or the adjacent ribs. And then if it has a lumborum in the name, again, it's going to insert somewhere in the lumbar region. So the spinalis group, there is a capitis. It's very poorly defined, so I'm not going to give origin insertion, but technically there is a capitis. The cervicus comes from the spinous process of the C7 vertebrae and then comes up through the upper cervical vertebrae up through C2, and also origins from the ligamentum nuchae. And then the thoracis group comes from the upper lumbar and lower thoracic and inserts up into the upper thoracic, and that's a thoracis. So that's a spinalis. The spinalis, because it lines up right over the axis of rotation, which is the spine, can only extend. It doesn't, none of those muscles have the potential to laterally flex or rotate. The longissimus group generally lines up over the transverse processes. So the longissimus capitis and longissimus cervicus are going to come both from the transverse process of the T5 vertebrae, and then the capitis is going to insert up into the mastoid process, into the head, and the cervicus is going to come to the upper cervical vertebrae, the transverse processes. And then the longissimus thoracis is going to come from the common tendon, and then it's going to insert into the transverse processes of the thoracic vertebrae, as well as the posterior surfaces of the ribs 1 to 9. And common tendon is just a term for there's a lot of muscle insertion down here in this lower spine region, and so common tendon just refers to a spot where a lot of them are coming from. So longissimus group, because it's off a little bit, has the potential to laterally flex the spinal column. Newman rates it as a moderate as opposed to like minimal or maximal. And then also you have the capitis and the cervicus and the thoracis can also rotate to the same side. It doesn't have a great potential, but it has a moderate potential. The iliocostis group, you have the cervicus and the thoracis are going to come from the posterior surface of the ribs 1 to 12, and then the cervicus group is going to insert into the transverse processes of the cervical vertebrae. The thoracis group is going to insert into the ribs 1 to 6, and then the lumborum of the iliocostis group is going to come from the common tendon and is going to insert into lumbar vertebrae 1 through 3, and then the ribs 6 through 12. And for the iliocostis group, the whole iliocostis group is capable of lateral flexion. It's got a better potential because it's farther away from the axis of rotation, but only the cervicus part can rotate, and that's probably due to the fact that the cervical spine has a lot more rotation. And the nerves for the erector spinae group are generally just given as the dorsal rami, because they just are innervated kind of segmentally as the nerves come off the spine. So turning it around to the other side, to the anterior wall, so muscles of the anterior abdominal wall include the abdominal muscles. So that would be rectus abdominis, the internal oblique, the external obliques, and the quadratus lumborum. So the rectus abdominis comes from the pubic symphysis and the pubic crest, inserts to the cartilage of ribs 5, 6, and 7 in the xiphoid process. So it's going to come straight down the middle, and so its only action is to flex the vertebral column. And so with some of the abdominal muscles, the obliques, for example, I'll talk about a bilateral and unilateral action, but because the rectus abdominis comes straight down the middle, all it can do is flex the vertebral column. It doesn't have the potential to rotate or to laterally flex. The external obliques come from the surfaces of the lower 8 ribs, and then they're going to insert onto the anterior part of the iliac crest, as well as the aponeurosis of the linea albia. The linea albia is basically kind of like where your belly button is, and if you look at pictures of muscles, you'll notice that in the middle it gets really white because that's a really thick tendinous insertion of the linea albia. It really helps link the sides together, so when muscles act bilaterally, they can produce a lot more force more efficiently. So it's a really thick kind of tendinous insertion in here. So the external obliques come from the ribs and insert come from the ribs and insert onto that anterior iliac crest and that abdominal aponeurosis of the linea albia. So the fiber direction is kind of like this. The way we always remember it in school is hands in pockets. Okay, so coming down from the ribs down here. So when acting bilaterally, so on both sides, the external oblique can flex the vertebral column. When acting unilaterally, it's just one side, it can laterally flex the vertebral column to the same side, and it rotates to the opposite side. Okay, so again, think of that fiber direction, hands in pockets. Think about if I'm moving this towards this, right? This is about where the origin is. This is where the insertion is. If I pull like this, okay, that's my right, this is my right external oblique. I'm rotating to the left. Okay, so it's all about the fiber direction. So external obliques is the opposite. The internal obliques come from the lateral inguinal ligament, which is kind of in here, from the thoracolumbar fascia or aponeurosis, which is kind of back here, the posterior or the iliac crest, and then they insert onto the linea albia, the aponeurosis of linea albia, and also the lower surfaces of the lower 3 ribs. Okay, so they kind of have a different. The inguinal ligament's kind of like here. So they kind of have a different fiber direction. Okay, if you can kind of imagine, they kind of stretch from in back because the thoracolumbar fascia, remember, is kind of in back. And they're going to come from, so the external obliques are like this. Internal obliques are kind of a bit more like this. Okay, so a bit of a different fiber direction. In fact, they're almost like the opposite fiber direction. And so you might expect that because they have an opposite fiber direction, that they would turn in a different way, and that's exactly the case. So while the external obliques are going to turn you opposite rotation, the internal obliques are going to pull you to the same side. Okay, so internal is same side, external is the opposite side. Okay, so if you can remember the fiber direction, okay, external obliques, hands in pockets, if you can remember that fiber direction, you can always remember that it goes to the opposite side. Internal obliques are the same side. So similar to the external obliques, the internal obliques, when they act bilaterally, they can flex the vertebral column and they can laterally flex to the same side. So the obliques are going to be synergists, okay, when they act together bilaterally, and they can be synergists when they act bilaterally for lateral flexion, okay. They're going to be antagonists for rotation, depending on which direction you're going. And then the transverse abdominis muscle, that comes from the lateral inguinal ligament as well, the thoracolumbar fascia, the iliac crest, and then the lower surface of the 9 ribs, and then it's going to insert onto the linea albia, that abdominal aponeurosis of the linea albia. So the transverse abdominis is a little bit different in that it doesn't really mobilize the vertebral column at all. It doesn't really we don't really talk about it in terms of a bilateral or unilateral action. What it tends to do is tend to compress the abdominal contents. It kind of comes around like this, and we frequently call it the corset muscle. So it kind of gently pulls things in. And actually all the abdominals can compress the abdominal contents. But the transverse abdominis doesn't have an action of the vertebral column in the true sense. It doesn't flex or laterally flex or rotate. It comes around like a corset and can just kind of gently compress the abdominal contents. When we do talk about posterior tilt, it's usually the transverse abdominis that we're really trying to activate. It's a muscle that's thought to be really key for kind of stability of the low back, okay, but doesn't really mobilize anything. The last muscle of the vertebral column is of the anterior wall is actually the quadratus lumborum. The quadratus lumborum is kind of a funny muscle because it's technically part of the anterior wall, but it's so posterior that it is almost an extensor. So it origins from the posterior iliac crest and inserts onto lumbar vertebrae 1 through 3, and then onto the last rib. When it acts bilaterally, so both acting together, it can help extend the vertebral column and also can help enforce exhalation by fixing that first rib. But when it acts unilaterally, it can either flex the vertebral column to the same side or it can elevate the pelvis. It's commonly known as the hip hiker. So when you do this action here, that's a quadratus lumborum activity. And it's pretty palpable. You can feel it on yourself when you bring it up that way. The nerve innervation for quadratus lumborum is going to be off the lumbar plexus 1 to 4. And I should say that the innervation for the abdominal muscles is just the intercostals and sometimes the ventral rami, but they're also innervated pretty much segmentally. So there's one other group on the posterior wall that I forgot to mention, and that was the multifidi and the rotaries. They're the deeper transversal spinal muscles, and they generally run up and down the spinal column. The multifidi start from the sacrum. The rotaries start more from the lumbar vertebrae, but they go up through the cervical vertebrae. They're relatively small muscles. They go from the transverse process to the spinous process. The multifidi will span 2 to 4 segments, so either 2 or 4, whereas the rotaries will only do 1. All right. So this is just an example of some thoracic vertebrae, and so if you think of the coming from the transverse process to the spinous process, okay, so here's my muscle coming from here to here. That could be a rotaries muscle spanning one segment. When the muscle shortens, it's going to pull the spinous process this way. So this is the right side, this is the left side, okay? So when it pulls, shortens that muscle, it's going to rotate it towards the left, even though it's pulling on the right, okay? So both the multifidi and the rotaries are going to rotate to the opposite side. And the nerve for the spinae and the multifidi and the rotaries is generally just described as a dorsal rami. It's just the nerves that kind of come off the spinal nerves.